Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for chlamydia. What is chlamydia? Chlamydia is a common sexually transmitted disease, in short STD. We can use this term STD throughout this video, that arises from infection of bacteria Chlamydia trachomatis. Infection spreads through oral, anal and vaginal sex. On the right hand side, the image of chlamydia has been shown. The top one is electron microscope. The lower one is ordinary microscope. How does chlamydia spread? Chlamydia spreads through oral, anal and vaginal sex with an individual already infected with bacteria. Semen has nothing to do with the spreading of infection. People treated with proper remedies and cured can get fresh infection from contact as described above. What is the relation between chlamydia and HIV? Persons with untreated chlamydia are predisposed to attract HIV. That is, they got HIV easily. Gays, bisexual and male persons with chlamydia attract HIV easily. What are the symptoms of chlamydia? Mind it, chlamydia is a disease and the name of the causative bacterium also chlamydia. There is a second name, trachomatis, but it is not generally termed. So, ordinarily chlamydia will refer to the disease. In a lot of cases, chlamydia remains symptomless. However, following signs symptoms are seen in most cases. In case of female, cervicitis, mucopurulent endocervical discharge or endocervical bleeding, painful sexual intercourse, urethritis, pyuria, dysuria, increased rate of urination. Pyuria means passing of pus through urine. Dysuria means painful urination. Pelvic inflammatory diseases affecting fallopian tubes, body of the uterus, ovaries, adnexal structures, tubal factor infertility, ectopic pregnancy, intermenstrual bleeding. Of this, ectopic pregnancy means a pregnancy which occur outside usual place, that is intrauterine, not intrauterine but outside this uterine, that is ectopic. Maybe pregnancy is within the fallopian tube or somewhere else, but not in the uterus. Intermenstrual bleeding is bleeding between the period. In case of male, urethritis, mucoid watery urethral discharge with dysuria, epididymitis with unilateral testicular pain, swelling, tenderness, painful ejaculation in both male and female, proctitis, rectal pain, discharge and bleeding, conjunctivitis, inflammation of conjunctiva of eyes. Proctitis means inflammation of the rectum. This is a picture where the symptoms usually occur in men and women in case of chlamydia infection has been shown. How does chlamydia affect a pregnant mother and her baby? There may be preterm delivery. There may be ophthalmia neonatorum. Neonatal means newborn baby with ophthalmia and pneumonia. Why in many a country of the world has screening of chlamydia become compulsory for all sexually active women? Social implication of women with chlamydia positive is a threat to the new generation. That is a threat to the society itself, the mankind itself. So, precautionary measures have been taken. Again, very often chlamydia remains silent. So, screening, a pathological test of all for chlamydia, that is all potential candidates, mainly the pregnant women, has been made compulsory for all sexually active women in many countries. This is sexually active women. This is again a advanced approach, not just during pregnancy but any sexually active women can get it. Generally, screening tests for male are not done, but in case of necessity, the same is enforced and adopted. The same procedure, screening test for male, is not generally in vogue, but it can be adopted if necessary. That depends on the particular nation and their policy. This is a picture on the right side, this picture of ophthalmia neonatum. Who are at risk to get infection of chlamydia? Sexually active people performing sex without condom. Sexually active people having multiple sex partners. Male people, for they often perform oral and anal sex. In fact, sexually active people get chlamydia for various behavioral, cultural and biological reasons too. So many other behavioral reasons, cultural reasons also there. How is chlamydia diagnosed? Generally, nucleic acid amplification test, NAAT, nucleic acid test is performed on swab collected from source of infection or urine of infected persons. How can chlamydia be prevented? Using condom in every sex can reduce chance of infection. Being in mutually monogamous relationship with a partner tested infection negative, that is being absolutely stick to a particular person, sex partner. Using a dam, a piece of thin latex to cover female genitals during oral sex or when rubbing female genital organs together. Avoid sharing sex toys. What complication may arise from chlamydia? PID or pelvic inflammatory disease. The picture is shown below on the left hand side. Prostate problem, infertility, infection of newborn, reactive arthritis, ectopic pregnancy. When to see a doctor? If there is a discharge from vagina or penis or rectum, there is pain during urination, get information that partner is chlamydia positive. That is, after performing sex, a certain individual gets this information. Now, the remedies, homeopathic remedies. Calcareous phos for chlamydia. Discharge viscid transparent like egg albumin. Asked to urinate always. Sticking pain and burning in urethra and at the neck of the urinary bladder. Burning before, during, after urination. Aching pain in waist and loin areas. Loin area means area of back, relevant, just opposite to kidney. Subject peevish, restless, fretful, forgetful, always want to go outside. The last one is not the symptom of the disease, but the symptom of the person himself. This symptom is very important for selection of calcareous phos. This must match with the patient before prescribing this medicine, because subjective symptoms are more important than particular disease symptom. Netamur for chlamydia, discharge of yellow, pus or clear. Cutting pain in urethra after urination, Blenoria urethrae, that is urethral orifice. From urethral orifice, discharge of thin discharge per urethra or per vagina. Urine deposits brick dust sediment, aching in testicles. Subjects cannot tolerate who offend them. Fuzz, consolation, weeps bitterly without cause, sad, reserved, absent-minded. The same thing. The last one is subjective symptom. The first is the particular symptom of the disease. Cannabis indica for chlamydia. Severe urge to urinate with much strain but cannot pass a drop. Has to wait some time before urine flows. Cordy well marked. Priapism, nymphomania. Cordy means actually birth defect of penis. The opening of the penis is somewhere else from where it should be. Priapism is the male's excess sexual desire. Nymphomania is the female excess sexual desire. Subject was in darkness lying down from coffee, liquor, tobacco, suffer from hallucination. Little distance seemed immense, time seemed too long, loquacious, forgetful of recent events. The last symptom is the general symptom. The first three symptoms are the particular symptoms of the disease. Cannabis indica sativa, cannabis indica indica, it was sativa. Cannabis sativa for chlamydia. For chlamydia, right? Patients walk very slowly with legs wide apart. Troubles worse during motion, smarting, burning during and after micturition. Constant urging with difficult urination, dark redness of glands and prepuce. Glands mean the head of the penis. Prepuce is the skin in front of the glands. Sleepy during day, sleeplessness at night. In women, cutting during micturition between labia. Labia is the thick lip of the vulva. Violent sexual orgasm. Orgasmus. Orgasmus and orgasm almost same meaning. The euphoria during sexual intercourse with swelling of labia. Medullum for chlamydia, burning in menses during urination, frequent call, feeling of soreness in urethra after urination, feeling as if something remained in the urethra, copious yellow purulent discharge in the morning, gumming up of the orifice of actually vagina. Subject want fanning all time, feel better lying on abdomen, fresh air, damp weather, seaside, stretching out, worse in cold, daytime and before storm. Nitric acid in chlamydia, small blisters on orifice of urethra and inner surface of prepuce. Smarting, burning during micturition. Micturition actually urination. Discharge sometimes bloody. Fine stitches through glands. Herpes like eruption and condylomata about genital and anus. Condylomata is skin disease actually. Eruption, soft, small eruptions. Like what like eruption, but it is soft. Horrible pain, much swelling and tenderness in testicles. Subjects irritable, vindictive, hateful, quarrelsome, tremble while in anger, feel better in a carriage. The last symptom is the general symptom, that is the symptom of the person as a whole. The first 2 or 3 symptoms are the disease symptom or particular symptoms. Silicea for chlamydia, discharge of thick fetid pus, especially after exertion. Constant feeling of chilliness even during exercise and scrofulosis. Scrofulosis is a term relevant to the particular homeopathy. There is no this term available in any other system of medicine, scrofulosis. That is, scrofulosis means it's an infection of congenital tuberculosis. Cases of long standing with slight and steady discharge. Subjects lack vital heat, always chilled, no amount of dress seems suffice. Worse from alcohol, bathing, mood changes. Better in warm dress, summer. Wet, humid weather after passing profuse urine. The last symptom is the person symptom. That is general symptom. The first symptom is the particular symptom of the disease. Thuja oxygenated from chlamydia. Discharge thin, greenish, with scalding pain during urination. Then sensation as if a drop remained behind. Violent urging in urethra while not urinating. Urinal stream forked, checked, clap, causes prostatitis, articular rheumatism, impotency, paralytic weakness of extremities and mental depression. Subjects suffer from fixed ideas as if body made of glass, as if a live thing inside the body, weep and tremble listening to music, fear green stripes. The last symptom, the general symptom. Sulfur for chlamydia. Discharge is thick, purulent or thin and watery with burning, smarting during urine with bright redness of the lips of the meatus. Lips of the meatus means lips of the meatus of the urethral orifice. Stitches and cutting pain during stool. Phimosis. Prepuce inflamed, indurated. Prepuce means the skin in front of the penis that is inflamed, and indurated means hard. Itching within the urethra. Coldness of feet and pain on top of head. Top of head at the vertex. Weak faint feeling during day. Sepia for chlamydia. Chronic mucus discharge without pain or burning when urinating. Peculiar. Without pain. Chronic discharge without pain when urinating. Discharges may be yellowish or milky. Urine turbid, offensive, copious sweat on genitals, fetid sweat in axilla. Pain in small of back. Small of back means actually lumbar vertebra. The area near lumbar vertebra, occipital headache, melancholia, all sexual desire gone. Subject so chilly, feel cold in warm room, anxious, fear over trifles, anxious, averse to family, to those love based, to sympathy, to company, yet dread to be alone. The peculiarity of CPI is that sad, irritable, alternating with indifference and sulkiness. With this, the video ends. Thanks for listening and viewing. If you got anything to share, please write down in the comment section. I will definitely respond.